Look around. It may seem like we're surrounded by potential infection hazards. In truth, almost any situation or encounter in long-term care can pose some form of hazard. The difference between an actual and a potential infection is in how we control it. Does this look like proper infection control?
Oh, bless you, dear.
Oh, thank you.
You're not getting sick, are you?
Oh, no. It's just a bug going around. And I'm sure I'll be fine, though.
How about this?
So how are you this morning, Mr. Howard?
Pretty good.
Did you have a good night?
Yes, we did.
Good. Well, it's time for your bath.
Yes. Thank you.
Or this?
Oh, I have something in my contact lens. Just a second, Mrs. Combs.
We can't afford to allow even minor lapses in infection control. The results can affect everyone. Since almost any situation can pose a hazard, we must be cautious and not place residents we serve at an increased and unnecessary risk. Controlling the spread of infection is like fighting an invisible enemy. When you take the appropriate steps, you should never see the results. Only when infection control breaks down do the hazardous effects become obvious. These effects can be painful. Our residents are at increased risk of infection. Many of them are sick, while others are elderly and more vulnerable. Many just cannot handle any further insult to their frail condition, and that is where we come in. This video will introduce infection control and outline the procedures you must take to ensure safety for you and your residents. Basic infection control methods are important for long-term care staff. Everyone should understand the range of safeguards, but proper hand washing and hygiene are still the most effective measure in an infection control program. Most of the infection risk we see have not changed over the years, but the dangers they pose have increased significantly. For example, our residents often receive antibiotics. Because of the increased exposure to antibiotics, some viruses and bacteria have become resistant to antibiotic treatment. As we said, people living and working in long-term care facilities are at increased risk of infection. It's due to a combination of conditions: advanced age, weakened immune systems, communal living environments, and antibiotic-resistant microbes. All make the risk that much more real. Still, one fact remains true. We must try to prevent infections before they can impact our health and safety. Unfortunately, infections acquired in healthcare institutions are common. We call these community-associated infections. Recent studies show that as many as 3.8 million infections occur each year in long-term care facilities across the United States. Now consider this whopping figure. Annual costs associated with these infections can exceed $1 billion. The statistics are staggering. It is estimated that residents experience at least one serious infection per year. Infections result in 63% of the deaths in long-term care. The most common infections are urinary tract, pneumonia, infected pressure ulcers, vascular ulcers, or diabetic foot ulcers. Several factors increase the risk of infection for residents. These are all things you see and know about your residents: chronic medical conditions that weaken the immune system, incontinence, depressed mental state of a lowered level of consciousness, use of devices like urinary catheters and feeding tubes, advanced age, and communal living conditions that promote the transfer of infections. Risk factors, trends, and statistics, they seem like numbers and not people, but they become real when we look closer at our facilities. Consider a typical resident, 85 years old, one or more chronic conditions, a weakened immune system, multiple medications, the resident may be confused and less aware of hygiene. She may be incontinent. She may be ambulatory and able to easily spread infection to the rest of the community. Long-term care facilities are communal, which fosters cross-contamination. If a resident arrives directly from a hospital with medical devices such as IVs, catheters, and feeding tubes, the risk of infection increases. Each of these risk factors poses hazard in our facilities. But another factor draws more attention to the importance of infection control: multiple drug-resistant organisms. These are microorganisms, predominantly bacteria, that are resistant to one or more classes of medication, often the antimicrobial agents that are most available and used. Organisms can become resistant if antibiotics are prescribed when they are not needed. Resistance can increase when the prescribed course of therapy is not completed as directed. These events contribute to the development of bacteria that no longer respond to antibiotics. When patients are infected with multi-drug-resistant organisms, treatment becomes more difficult and the cost of care rises. But above all, the likelihood of recovery declines. Quality care drives decisions made in our facility. By law, the facility must establish and maintain an infection control program designed to provide a safe, sanitary, and comfortable environment and to help prevent the development and transmission of disease and infection. The law is specific. We must establish and maintain an infection control program which investigates, controls, and prevents infections in the facility, decides what procedures such as isolation should be applied to an individual resident, and maintains a record of incidents and corrective actions related to infections. Check with your supervisor to see where your protocol is posted. Any long-term care facility receiving assistance from Medicare and Medicaid must follow a set of requirements that addresses infection control and includes definitions of infection, risk assessment, outbreak control, and antibiotic monitoring. Following your facility's infection control program helps ensure accreditation and strengthens your facility's performance during survey review. So it's not just about quality care. If we don't comply with regulations, we increase the chance of litigation stemming from the occurrence of infection. The law states the hard facts. Still, our main concerns center around care for ourselves and our residents. For residents who live here, this is both a healthcare facility and a home. As caregivers, we should prioritize infection control, but we also need to carefully balance against our residents' needs for socialization, mobility, and privacy. Diagnosing infections in older individuals can be difficult. Symptoms can be nonspecific, and residents may suffer from other illnesses that mask detection. That's why prevention is so important and often challenging. Here are the steps you must take to protect your residents and yourself against infection. It all starts with practicing proper hand hygiene. Follow standard precautions regarding barriers, sharps, and patient care and placement. Be aware of infection control when handling food or administering a tube feeding. Practice thorough and antiseptic housekeeping techniques. By making sure these procedures become part of your care routine, infection control will become second nature. Let's look at hand hygiene techniques. Your hands come in direct contact with microscopic bacteria every day. Through touch, you pass bacteria onto others or yourself. Hand hygiene, again, is a primary means of preventing the transmission of infection. Consider this list of precautions and some situations that require hand hygiene. When coming on duty or when hands are visibly soiled, wash hands with soap and water. Before and after direct resident contact, hand washing and hygiene is a required professional practice. Wash your hands before and after performing any invasive procedure like finger stick or blood sampling. Before and after entering isolation precaution settings. Wash your hands with soap and water before and after eating or handling food. Before and after assisting a resident with meals. Before and after assisting a resident with personal care like toothbrushing or bathing. Before and after handling peripheral vascular catheters and other invasive devices. Before and after inserting indwelling catheters. Before and after changing a dressing. Upon and after coming in contact with a resident's intact skin. For example, when taking a pulse or blood pressure and lifting a resident. After using the toilet. Before and after assisting a resident with toileting. After contact with a resident with infectious diarrhea, including but not limited to infections caused by norovirus, salmonella, shigella, and difficile. After blowing or wiping nose. After contact with the resident's mucous membranes and body fluids or excretions. After handling soiled or used linens, dressings, bedpans, catheters, and urinals. After handling soiled equipment or utensils. Always wash your hands with soap and water after performing your personal hygiene, after removing gloves or aprons, and after completing duty. There's a proper way to wash your hands, and technique makes a difference. Infection control can only work when staff members are committed to keeping hands free of bacteria. What is proper hand washing? What you just saw was not enough. Try it out for yourself. Wash your hands as you usually do. Washing your hands correctly takes a little more time and attention. With an antibacterial soap, use warm water to lather for at least 20 seconds. Angle your fingertips down. Lather to 2 inches above the wrist and scrub down to your hands. Interlace and lather between your fingers. Scratch your fingernail tips through the lather on your palms. Rinse, beginning above your wrist, and allow the water to flow down off of your fingertips. Dry your hands with a clean towel and discard. Do not touch the faucets. Use another clean, dry towel to turn off the water and open any door handles if necessary. If needed, apply disposable gloves immediately after washing. Now, use a glow germ to check for germs again. Look at the difference. How you wash your hands is obviously important, but so is when you wash them. Always wash after removing gloves and protective gear, handling biohazard containers, coming in contact with body fluids, handling personal care equipment like bedpans, catheters, and cosmetics, handling soiled laundry, handling food or eating utensils, personal toileting, and after assisting residents with their medication, dressing, eating, drinking, or toileting. As we discussed, there are circumstances where hand washing is specifically required. Gloves or the use of baby wipes are not a substitute for hand hygiene. Alcohol-based rubs are convenient, effective, and save time. Sometimes they can be used for cleaning hands and in direct resident care. In fact, the Centers for Disease Control recommend the use of alcohol-based hand rubs to keep your hands bacteria-free. Antiseptic rubs do not replace hand washing, but they can provide valuable protection from bacteria in certain cases. You can use alcohol-based rubs when hands are not visibly soiled, before having direct contact with residents, after contact with a resident's intact skin, such as taking a pulse or lifting a resident, during resident care if moving from a contaminated body site to a clean body site, after contact with objects, including medical equipment, in the immediate vicinity of the resident. When using alcohol-based rubs, apply product to the palm of one hand. Rub your hands together, covering all surfaces of your hands and fingers. Rub until your hands are dry. After every 5 or 10 uses of antiseptic gel, always wash hands with soap and water. It doesn't stop there. Demonstrate proper hand washing to residents and remind visitors and volunteers to wash properly and often. Standard precautions are guidelines recommended by the Centers for Disease Control and Prevention. They help caregivers reduce the risk of transmitting blood-borne or other pathogens to control the spread of infection. Standard precautions describe infection control techniques that apply to blood, all body fluids, secretions, and excretions except sweat, regardless of whether or not they contain blood, non-intact skin, and mucous membranes. There are 3 categories of standard precautions: barrier protection, Sharps precautions, and patient care and placement. Barrier protection. The use of gloves, gowns, and masks protects your skin, body, clothes, and face from exposure to organisms. Always utilize these barriers when you expect to come in contact with contaminated materials. Wear gloves anytime you touch a resident to prevent transferring microbes. Also wear gloves when handling body fluids, food, utensils, soiled laundry, and equipment. But remember that using gloves does not eliminate the need for hand hygiene. Use appropriate transmission precautions to prevent spreading infectious agents. Wear protective gowns when needed. Remove gowns immediately and dispose of them appropriately. Wear safety goggles and a mask when there is a potential for splashing or spraying of body fluids. The Centers for Disease Control and Prevention recommend dressing and removing personal protective equipment in a specific order. When putting them on, first dress in the gown, mask respirator, goggle mask, and finally gloves. When removing personal protective equipment, take off the gloves, goggle mask, gown, and finally the mask respirator. Also, after you've used personal protective equipment, OSHA regulations require you to remove them before leaving the room. You must then dispose them in an appropriately designated area or container for storage, washing, decontamination, or disposal. Never handle the contents of a container or biohazard bag, even while wearing disposable gloves. Some individuals experience allergic reactions to latex, such as a skin rash. If you experience any allergic symptoms associated with latex, discontinue exposure and immediately notify a doctor, then use latex-free disposable gloves. Sharps precautions outline the procedures for handling and disposing of needles, syringes, and razors. Always be careful when using sharp instruments or devices. Use proper barrier protection. Avoid touching or breaking needles and razors during or after sharps use and disposal. Do not recap, bend, break, or otherwise manipulate used needles by hand. Keep your hands clear of the inside of sharps containers. Do not remove used needles from disposable syringes. Never dispose of sharps in regular trash cans. Even unused needles and razors are hazardous because they can puncture plastic trash bags. Always discard sharps in puncture and leak-proof containers. Place used sharps in labeled or color-coded puncture-resistant, leak-proof closable sharps containers for disposal. Do not overfill sharps containers. Consider the use of alternative non-sharps equipment whenever possible. Patient placement precautions are designed to protect against the spread of infection throughout the facility. Transmission-based precautions are used for residents who are known to be or suspected of being infected or colonized with infectious agents. These infectious agents include pathogens that require additional control to prevent them from being transmitted to others. Rarely do we need to isolate residents with active infections if we follow proper infection control. When a resident needs isolation to prevent the spread of infection, we are required to isolate the resident. For example, residents infected with antibiotic-resistant organisms should be moved to a private room to protect the rest of the community. When a private room is unavailable, try to house residents together when they have the same infection. If this is not possible, avoid placing other susceptible residents in the same room. Isolating residents is a delicate balance between protection of the other residents and maintaining the independence, dignity, and privacy of the infected individual. We consider several factors: the need for more than one occupant in a room, the presence of risk factors that increase the likelihood of transmission, and the potential to psychologically disturb an infected or isolated resident. The American Health Insurance Portability and Accountability Act, or HIPAA, outlines resident privacy rights. Know and follow your facility's policies and procedures when taking steps to protect your residents. Always be sensitive to individual rights as well as a resident's right to privacy. Transmission precautions are important during treatment of infections as well as during control and prevention. An infection outbreak in the community can be devastating. Barrier protection, sharps precautions, and patient care and placement. Become familiar with standard precautions. Then use them in resident care when handling food and providing housekeeping services. Finally, as caregivers, communicate these precautions clearly around our facility. Signs and verbal reporting between staff can enhance compliance with transmission-based precautions and help minimize the transmission of infections within the facility. Food service and long-term care facilities can easily be exposed to bacteria. Cooking and eating utensils also provide an opportunity for infection, if not thoroughly washed before and after use. Good infection control requires proper food handling. Follow your facility guidelines regarding food preparation, kitchen hygiene, and food storage. Also, follow standard procedures when serving meals and using enteral feeding or when residents require assistance in eating. Staff who prepare, handle, or serve food should wash their hands thoroughly to prevent the contamination of food, utensils, or the preparation area. Staff members should also wash their hands between preparing raw and ready-to-eat food items or serving different residents to prevent cross-contamination. Meals should be served while they are in the safe temperature zone to maintain microbial safety and prevent foodborne illness. Staff members who serve meals should practice good hand hygiene, wear disposable gloves, and use clean utensils and equipment. When storing food or beverages for a resident or yourself, keep them separate from non-food items. A designated refrigerator should be clearly marked and used only for biohazardous items. Dispose all food waste in designated areas such as the kitchen or cafeteria. All food waste, used utensils, and eating equipment should be considered contaminated. Use gloves when handling food waste, used plates, beverage containers, and utensils. Tube-fed residents are vulnerable to microbial contamination and foodborne illness. When preparing and administering tube feedings, always use sanitary technique. Wash your hands thoroughly before handling formula, an administration set, or feeding tube. Sanitize all equipment and surfaces used for formula preparation. Sanitize containers of ready-to-use formula before opening. Avoid touching anything that will come in contact with the formula. Wear disposable gloves. Anything that increases the handling of formulas or administration sets also increases the potential for contamination. Do not add water, medications, or other substances directly to the formula. Commercially available formulas are recommended. Formulas should always be used at full strength. When necessary, reduce the administration rate of the formula rather than diluting it. Use clean technique to add medications to the feeding tube. You can also reduce handling by using commercially available closed systems that are pre-filled with tube feeding formula. Good housekeeping can help prevent and control infection. Let's look at this ultraviolet view. It illustrates why housekeeping is so important in protecting residents from the threat of infection. Shake a small amount of glow powder onto a surface and lightly dust it over the entire area. Clean the surface until all the visible powder is gone. Use an ultraviolet lamp to see the remaining traces of the powder glowing in areas that were not cleaned thoroughly. Now, use the ultraviolet lamp to examine the rest of the room for contaminants. Turn off all the lights and pass the lamp over all of the furniture and surfaces. Most body fluids naturally fluoresce a green-yellow under ultraviolet light. Blood specifically fluoresces a dark red or black. As you can see, proper housekeeping procedures and infection control go hand in hand. Disinfect all work surfaces at routine intervals and when they become soiled. Remove and replace all leak-proof protective coverings upon contamination. Regularly inspect and decontaminate reusable containers. Never pick up glass pieces by hand. Remove contaminated broken glass with collective tools. Never reach into any hazardous waste, laundry, or sharps container. Collect contaminated, reusable sharps in containers for storage and processing. Always double bag all biohazard materials using leak-proof, color-coded bags or bags with biohazard labeling. All soiled laundry is considered contaminated. Always wear gloves when handling soiled linen. Deposit all used clothing and linens in impervious plastic bags as close to the area of use as possible. Never overfill or handle existing contents of biohazard containers or laundry bags. Good housekeeping should consider the guidelines of a comprehensive infection control program, but it begins with the techniques and practices we use as caregivers. At first, some methods may be cumbersome. You need to get used to washing hands more thoroughly and to learn to take extra precautions. Eventually, these practices become second nature. Soon you will find yourself protecting against infection without even realizing it. Communication is critical to an effective infection control plan. Be open and honest with staff, residents, volunteers, and family members. Ask questions if you need more information. Stay educated on resident needs and risk factors. Your role in infection control will pay off in the increased overall health and safety of your residents. Infection control also protects you from illness or infection due to cross-contamination. When infection control becomes a priority in any long-term care facility, both the residents and staff members can feel safer and more comfortable in their everyday lives. And in some cases, your efforts may actually save some lives. That's the real measure of how we care. The lives we save and the quality of living that results from the service we provide.